79% of the people who will develop Alzheimer's disease in the next decade are sleeping in a position tonight that is actively accelerating that process. Not because of what they eat, not because of their genetics, because of how their head is angled against a pillow for 7 or 8 hours every single night. I know that sounds alarming, and I want to be honest with you, where it alarmed me too the first time I truly understood what the research was showing. Because for years we told patients, just get your 8 hours. We focused on duration, we focused on sleep hygiene, and almost nobody was talking about this. My name is Dr. Ming Chen. I'm a neurologist with over 22 years of clinical experience, and I've spent the last decade specifically focused on cognitive decline, cerebrovascular health, and what I call the hidden architecture of aging brains. I've seen thousands of patients in my clinic, and I can tell you with complete confidence that what I'm about to share with you today is one of the most underappreciated topics in medicine for people over 60. We're going to talk about sleep position. We're going to talk about what your brain is actually doing while you sleep, why that process depends critically on how your body is oriented, and the 4 sleep positions I see patients use, ranked from the one that is quietly destroying your brain health to the one that supports it best. And I'm going to give you everything you need to make a change starting tonight. Let me start with the concept that ties everything together, because once you understand this, nothing about sleep will ever look the same to you again. Think about a city at night. While everyone is sleeping, the sanitation trucks come out, they travel through every street, every alley, every corner, and they remove the waste that build up during the day. If those trucks can't get through, if the streets are too narrow, if there's an obstacle blocking the road, the garbage piles up. And if that happens night after night after night, the city starts to deteriorate in ways that are slow at first, then very suddenly catastrophic. Your brain has its own sanitation system. It's called the glymphatic system, and it only operates at full capacity while you sleep. During the day, your neurons are firing constantly, generating metabolic waste products. The most important one, and I need you to hear this name, is amyloid beta. Amyloid beta is the protein that forms the plaques we find in the brains of Alzheimer's patients. It is produced every single day, and it must be cleared every single night. The glymphatic system does this by pumping cerebrospinal fluid through channels in the brain, flushing out those waste products into the bloodstream, where they can be safely eliminated. It is elegant. It is powerful. And here is what the science is now showing us with remarkable clarity. It works dramatically better in some sleep positions than others. A landmark study published in the Journal of Neuroscience conducted by researchers at the University of Rochester used real-time imaging to observe glymphatic flow in living subjects across different body positions. The findings were striking. The lateral position, lying on your side, showed significantly greater glymphatic efficiency than the supine position, lying on your back, and vastly greater efficiency than the prone position, lying on your stomach. We're not talking about a marginal difference. We're talking about a difference that, compounded over years and decades, may have profound implications for who develops cognitive decline and who does not. So, let's go through the 4 most common sleep positions I see in my patients, and I'm going to be very direct with you about what each one means for your brain after 60. Position number 1. Sleeping on your stomach, face down or head rotated sharply to one side. This is the worst position for brain health at any age, but especially after 60. Here's why. When you sleep face down, you're putting direct pressure on your cervical spine, the vertebrae in your neck. You're also compressing the vertebral arteries, which are 2 of the 4 major vessels that supply blood to your brain. Reduced blood flow means reduced oxygen delivery to your neurons during the very hours when your glymphatic system is trying to do its most important work. You're essentially asking your sanitation trucks to operate while someone is restricting the fuel supply to the engines. But there's more. I have a patient. I'll call her Patricia. She's 67, a retired school teacher from outside Boston. Patricia came to me 2 years ago complaining of morning headaches, neck stiffness, and what she described as a fog that took hours to lift every day. She had been a stomach sleeper her entire adult life. When we reviewed her sleep study data and imaging, her cervical spine showed significant degenerative changes, and her cognitive testing revealed early stage processing speed deficits. Patricia was convinced it was early dementia. She was terrified. We changed one thing. We worked with her over 3 months to transition to side sleeping using a body pillow system I'll describe in a moment. 6 months later, her morning fog was gone. Her headaches had resolved. Her follow-up cognitive testing showed measurable improvement. Patricia cried in my office when she saw those results. She said, "I thought I was losing my mind. I was just sleeping wrong." I think about her every time I see a new patient who sleeps on their stomach. Position number 2, sleeping on your back, flat, with no pillow or a very flat pillow. This is better than stomach sleeping, but it has a critical problem for many people over 60, and that problem is called positional obstructive sleep apnea. When you age, the muscle tone in your throat and upper airway decreases. When you lie flat on your back, gravity pulls the soft tissue of your throat directly downward, narrowing the airway. The result is intermittent obstruction, brief pauses in breathing that can occur dozens or even hundreds of times per night. Now here's what most people don't realize. You don't have to be snoring loudly to have positional sleep apnea. You can have silent apnea events, and each one of those events, each pause in breathing, triggers a micro arousal in the brain, floods your system with cortisol and adrenaline, and disrupt the slow wave sleep stages during which glymphatic clearance is most active. A study in JAMA Neurology found that patients with untreated sleep apnea had significantly higher levels of amyloid beta accumulation in the brain than matched controls who slept normally. The connection between sleep disordered breathing and Alzheimer's risk is no longer theoretical. It is one of the most robustly replicated findings in sleep medicine. If you sleep on your back and wake up tired, wake up with headaches, or have been told you snore, this is for you. Position number 3, sleeping on your right side. Better, significantly better than the first two. You are now allowing the glymphatic system to operate more efficiently. However, there is a specific concern for people over 60 who sleep on their right side, and it relates to cardiovascular health rather than neurological health directly. The heart sits slightly to the left in the chest, and sleeping on the right side can, in some patients, create a subtle positional shift that increases the mechanical load on the heart during sleep. For patients with heart failure, significant valve disease, or arrhythmia, right side sleeping can worsen symptoms overnight. There is also evidence suggesting that right side sleeping may be associated with slightly higher rates of acid reflux during sleep, as the lower esophageal sphincter is positioned in a way that makes reflux more anatomically likely. If you've ever woken up with a burning sensation in your chest or throat, your sleep position may be a contributing factor. Position number 4, sleeping on your left side. This is, based on the current body of evidence, the optimal sleep position for the vast majority of people over 60 for brain health. Let me explain why. In the left lateral position, the glymphatic system functions at its highest observed efficiency. The lymphatic drainage of the brain is enhanced. The heart is in its most supported anatomical position. Acid reflux is minimized because the stomach sits below the esophageal junction in this posture. And for people with positional sleep apnea, left side sleeping opens the airway more effectively than any other non-medical intervention we have. A research team at Stony Brook University used MRI to directly image glymphatic transport during sleep and found that the lateral position, and particularly left lateral, showed the most favorable clearance dynamics for metabolic waste, including amyloid beta and tau protein, both of which are implicated in Alzheimer's and other neurodegenerative conditions. Now, I want to pause here and ask you something directly. Before we continue, I want to know, which of these 4 positions do you sleep in right now? Leave a comment below. Tell me. Because when I read those comments, I can see what this community is dealing with, and it shapes the content I make for you. And if you're finding this valuable, if you've never heard this framed this way before, please take a second right now, hit that like button, and subscribe to the Dr. Ming Chen channel. It takes 2 seconds, and it means I can keep making content like this for free. You deserve to have this information. Now let me address the question. I know many of you are thinking, what if I simply cannot sleep on my left side? What if I've tried and I always wake up on my back? This is where the practical mechanics matter, and I want to give you 4 specific tools that my patients have used successfully to make and maintain this transition. Tool number 1, the positional pillow system. Place a firm body pillow along your entire right side, from your shoulder down past your hip. This creates a physical barrier that your sleeping brain will naturally resist rolling over. It's not elegant, but it works. Within 3 to 4 weeks of consistent use, most patients report that side sleeping begins to feel natural. Tool number 2, the knee pillow. One of the reasons people abandon side sleeping is hip and lower back discomfort. When you lie on your side without support between your knees, your top leg drops forward, rotating your pelvis and creating significant strain on the lumbar spine. A medium-density pillow between your knees neutralizes that rotation and eliminates most of the discomfort. This single change makes side sleeping sustainable for the majority of my patients who struggle with it. Tool number 3, pillow height calibration. Your cervical spine, your neck, should be in a neutral position, not angled upward, not drooping downward. For most people sleeping on their side, a medium to firm pillow that fills the gap between your shoulder and your ear is correct. If you're waking up with neck stiffness, your pillow is almost certainly the wrong height. This is fixable and it costs nothing to experiment. Tool number 4, the tennis ball technique. This is old, but it is genuinely effective for people who roll to their backs during the night. Sew or tape a tennis ball to the back of a sleep shirt. When you roll onto your back, the discomfort is enough to prompt unconscious repositioning without fully waking you. Within 2 to 3 weeks for most people, the side sleeping habit is established, and the tennis ball becomes unnecessary. Now, I want to talk about something that goes beyond position, because sleep after 60 is not just about where your body is, it's about the quality of what's happening neurologically during those hours. And there are 3 things that many of my patients are unknowingly doing, often on the advice of well-meaning people, that are quietly sabotaging the very sleep architecture their brain needs to stay healthy. The first is alcohol as a sleep aid. I hear this constantly. A glass of wine helps me fall asleep. And it does. Alcohol is a sedative, and it shortens the time it takes to lose consciousness. But here is what it also does. It dramatically suppresses REM sleep and deep slow wave sleep in the second half of the night. These are the exact stages when glymphatic activity is highest. You may be sleeping 8 hours and getting the glymphatic benefit of 4. A study in the journal Alcoholism, Clinical and Experimental Research found that even moderate alcohol consumption within 3 hours of bedtime reduced slow wave sleep by up to 20% in adults over 55. If you are using alcohol to sleep, you are trading short-term ease for long-term neurological cost. The second is late evening screen exposure. And I'm not just talking about blue light, I'm talking about content. When you watch stimulating content, news, drama, anything that generates emotional arousal, your brain releases cortisol. Cortisol suppresses melatonin production. But more importantly, for people over 60, cortisol has a direct inhibitory effect on glymphatic function. Your brain quite literally cannot clean itself properly when it's in a state of stress arousal. The last 90 minutes before sleep should be protected, dim light, calm content, or better, no screens at all. The third is inconsistent sleep timing. I have a patient, I'll call him Robert, 71, a retired engineer who spent decades doing shift work. Robert takes excellent care of himself. He exercises, eats well, doesn't drink, but he sleeps at midnight 3 nights a week and at 9 o'clock the other 4. His circadian rhythm is permanently disrupted, and when we looked at his inflammatory markers and cognitive testing, despite all his healthy habits, his results were worse than patients 15 years younger who simply had consistent sleep schedules. The brain's glymphatic system is circadian dependent. It is optimized to run during specific biological hours. Disrupting your sleep timing doesn't just make you tired, it disrupts the scheduling of your brain's entire waste clearance operation. Let me give you the concrete action plan. Here is exactly what I want you to do starting tonight. 1. Identify your current sleep position honestly. If you are a stomach sleeper, accept that this is the single highest priority change you can make for your long-term brain health. Begin transitioning tonight using a body pillow on your right side to guide you toward left lateral. 2. Evaluate your pillow. Lie on your side right now, on the floor if you have to, and notice whether your neck is neutral. If it's not, adjust the height before you sleep tonight. 3. Place a pillow between your knees. Do this tonight. See how it changes your comfort level. 4. Set a consistent sleep time and wake time and commit to it for 30 days. Not a flexible window, a specific time. Your brain will recalibrate. 5. Eliminate alcohol within 4 hours of your sleep time. If you need a transition strategy, try a small amount of tart cherry juice, which contains naturally occurring melatonin precursors, or a brief warm shower, which reliably drops core body temperature and initiates sleep onset. 6. Create a 90-minute screen-free wind-down. Start small if you need to. Even 30 minutes is better than nothing. 7. If you snore, wake unrefreshed, or have a partner who tells you that you stop breathing at night, please talk to your physician about a sleep study. Sleep apnea is one of the most treatable and most underdiagnosed conditions affecting people over 60, and the cognitive consequences of leaving it untreated are serious. Before I go, I want to be very clear. Everything I've shared today is general medical information based on the current research literature. It is not a substitute for a personalized evaluation by your own physician. Please do not make significant changes to your sleep environment or health routine without consulting your doctor, especially if you have existing cardiovascular, neurological, or musculoskeletal conditions. But I also want to say this. You came to this video today because something in you recognized that you deserve better information than the generic advice most people get. You were right to look. The research on glymphatic function and sleep position is real. The connection between how you sleep and how your brain ages is real. And the changes I've described, a different pillow, a different position, a body pillow between your knees, these are not complex. They are not expensive. They are available to you tonight. That is what the Dr. Ming Chen channel is here for. Not to frighten you, not to sell you anything, to give you the clinical information you deserve to have in plain language so you can make genuinely informed decisions about your health. If this video helped you, please give it a like. It takes 1 second and it helps this information reach the people who need it. Subscribe if you haven't already because I put out new content every week. And the topics we cover here are exactly the things your doctor wishes they had more time to explain. Leave a comment and tell me which sleep position you use. Tell me what you're going to change tonight. I read every single one, and your comments shape what I make next. Take care of your brain. It is the only one you have, and it is working very hard for you every single night while you sleep.